In the UK, inflammatory bowel disease, like in most of the Western world, is very common. It now affects up to 1 in 100 people. It can affect all ages, but mostly we diagnose it in young people. And this is important because IBD is incurable, and that means for too many patients there is a lifetime of unpredictable and intrusive symptoms with drugs that don't work for everyone and for many have unacceptable toxicity. All too commonly, patients will come for surgery, and altogether this equates to a high burden of disease and a very high psychosocial burden. So for many of our patients, unfortunately, there are high rates of depression and anxiety and fatigue, as well as the classic gut symptoms and extraintestinal manifestations of IBD. And much of this, particularly the psychological impact, has been made worse during the COVID-19 pandemic and through lockdown. Now, in the last decade in the UK, we have made very good advances in IBD care. We have improved the standards, and indeed we now have UK IBD standards, and this has been affected through good education, training, and excellent specialist nurse support, albeit not across the board. However, this good increase in care has not been matched by appropriate increases in psychological or behavioural support for our patients. And this is a big problem and a worrying trend because we've known we need it, but we haven't to date found a way of impacting this for our patients. Now, Trellus, I think, is a really great solution for this for our patients across the world, but particularly in the UK, because it has the opportunity to deliver truly interconnected, hyper-personalized care for patients that is continuous, that can continue throughout and in between visits. And this is disease monitoring, symptom monitoring, calprotectin and inflammation monitoring, but most importantly, a hyper-personalized behavioral coaching system to help our patients improve their resilience, and so that our patients can cope better with disease where they need it. Now, not everyone needs this, but where they need it, and that can enable us to effect better care. And I am sure that, as has been shown in the US, that we will see in the UK that this impacts better outcomes for our patients today and tomorrow. Thanks for your time.